Hello, I'm Dr. Kevin Smith. I'm a clinical professor at the University of Oklahoma College of Dentistry and the Oral and Maxillofacial Surgery Department. I've been the clinic director at the J.W. Keyes Cleft Palate Craniofacial Clinic at the University of Oklahoma since 1996. I would wager that this is probably one of the oldest interdisciplinary programs on campus. The J.W. Keyes Cleft Palate Craniofacial Clinic has been active since 1959. It was originally housed in the Allied Health Speech and Hearing Center, is now housed and administered at the College of Dentistry and the Department of Oral and Maxillofacial Surgery. The clinic is approved by the American Cleft Palate Association, and this certification by the ACPA is a arduous task in that it makes sure that you provide appropriate care to these kids on a long-term basis. A specialist approved and participating in this clinic include oral and maxillofacial surgery, otorhinolaryngology, speech pathology, orthodontics, maternal fetal medicine, audiology, pediatric dentistry, genetics, social work, and family counseling. The clinics meet once a month with a meeting about each child after the clinic to discuss what their issues are and where they need to go over the next year. Interdisciplinary care is very important due to the longitudinal nature of care for these kids, as the growth changes from previous care cancels out the previous care. You must provide a roadmap for the families, and we have to coordinate the care between the critical specialties. The team meets once a month, and we typically have anywhere from 12 to 20 patients. The patients are seen by the audiologist and speech pathologist first, then they come to the College of Dentistry, where the residual specialists take a look at the patient and make recommendations for their further care. The rest of this lecture will involve other specialists from the team, including oral and maxillofacial surgeon, orthodontics, and speech and language pathology.
Hello, my name is Fabio Ritto, and I'm happy to be here today to talk about the experience we have with our interdisciplinary team on the Cleft Palate and Craniofacial Clinic at OU. I'm going to discuss the role of the oral maxillofacial surgeon on the cleft patient. The first surgery in a cleft patient is the lip closure, usually around 3 months, when the infant is able to undergo surgery. That moment is determined through different criteria such as weight and the red blood cell count. The second surgery is the palate closure, which happens around the first year. Closed in palate is important to create an anatomical separation between the mouth and the nose. This is very important for speech development. Even though the palate has been reconstructed, it may not reach an adequate length, which may generate a condition called velopharyngeal insufficiency. In this condition, there is air leak from the mouth to the nose during speech, which impairs adequate pronunciation of certain sounds. Then a speech surgery is necessary along with speech therapy to provide velopharyngeal competency and an intelligible speech. Around 8 to 12 years, a bone graft is required to reconstruct the incomplete alveolar bone and permit adequate eruption of the permanent dentition. Another common finding in these patients is a hypoplastic upper jaw. And upon completion of skeletal maturity, which takes place around 14 to 16 years of age, it is time to perform the jaw surgery and correct the position of the jawbones. Finally, when patients are around 15 to 18 years old, they may undergo nose surgery. Because of the cleft, the cartilaginous structure of the nose is weak, and during the rhinoplasty, cartilage graft is used to reinforce the nose foundation, providing adequate position and projection. At any point in time, patient may require revision surgeries to address any remaining problem.
Role of an orthodontist on the cleft palate team. We always answer questions the parents might have about their child's dental development. Often the children are too young to begin orthodont treatment, so we will simply provide an estimated timeline for when decisions will be made about treatment in the future. We'll also give guidance as the child gets older as to when orthodont treatment should be initiated. When it is appropriate to begin orthodont treatment, we'll make referrals to an orthodontist, either in the area or in the communities where they might live across the state. We'll also discuss with the other specialties, especially the other dental specialties on the team, to coordinate comprehensive treatment for the child.
Today we're going to talk about speech management for cleft lip and palate. I'm Shelley Geddes, and I'm the co-director of the Cleft Palate Craniofacial team. One of our first priorities after birth is ensuring the baby is feeding well and getting proper nutrition. The feeding guidelines are listed below. Thanks to a Smile for a Child Foundation, our team is able to provide specialty bottles at no cost to the families. After infancy, we start to focus on speech language development. From 0 to 3 years of age, we want to facilitate speech language acquisition. We work closely with the ENT and the audiologist to ensure the ears are functioning properly and the child is hearing well. Normal hearing is essential to good speech language development. It's important to work on placement for speech sounds prior to the speech surgery if that surgery is needed. Around 3 to 5 years of age, we begin to evaluate for velopharyngeal insufficiency. We need to determine if this child needs another surgery to help them with speech. The SLP and the surgeon work closely together to determine whether the child has VPI. If a VPI is structural in nature, they will need a surgery. If the errors that the child is producing are compensatory in nature, they can be fixed with speech therapy alone. There are a couple of tools and procedures that can help us visualize velopharyngeal closure. The first one is a video fluoroscopy, and the second one is a nasal endoscopy. I'm sure the surgeons will speak more in depth about these procedures, but I wanted to just touch on them briefly.
In summary, the J.W. Keys Cleft and Craniofacial Clinic at the University of Oklahoma has helped enhance the lives of children with cleft and facial differences since 1959. This multidisciplinary group meets on a monthly basis. They meet kids face to face and provide a roadmap for the patient's families so that they know what to do over the next year. The kids are typically seen once a year, and through this interdisciplinary clinic, we can create productive and well-adjusted citizens in Oklahoma. I'd like to take this opportunity to thank you for your attention and would like to entertain any questions at this point in time. Thank you.